Good morning. I'm glad that you could join us for this latest edition of Health Talk on Sun FM Radio and TV with me, Lamek Zulu, popularly known as Folex. Professionally is what I love. Professionally known as Folex. So today, like any other Saturday, we take time to learn about health issues that surround us, and today we will look at a topic that we've taken granted of, or that which has been taken for granted. We're talking about dental health awareness. So today landa pameno baraba kwatama issues yameno. This is the time that you get to learn more about how to take care of your teeth. So to help me dissect this topic, I have Dr. Mijelo Sayela, who's a dental surgeon under the Dental and Maxillofacial Department in Ndola Teaching Hospital. Doctor, how are you doing today? I'm great. At least my teeth are okay.
Yes, they are.
And then also joining us in studio is Miss Chitaluka Pena, who's a dental technologist and obviously under the same department. How are you doing, Madam Kapena? Okay, so quickly let's look at what we have. Obviously, as we talk about the dental arrangement, just for the sake of somebody who's listening to us for the first time and they would want to know what dental pain is, Dr. Mijelo, help us understand this.
Okay. For dental pain, we are talking about a condition that will definitely affect your oral structures. Mm-hmm. So this will involve your face, your neck, sometimes it even spreads to other body regions. Yeah. So usually, when you want to look at pain, you look at the biological process of pain. Pain involves tissue damage. Mm-hmm. So what is happening right now is this is a patient or a person like we are. If you look at anatomy of the tooth, the tooth structure itself, it has got the enamel, the dentine, and the cementum. So usually you find that there is the living part of the tooth, which we call the nerve supply of the tooth. Those are the structures. The pain would come as a result of that infection or anything that will reach the pulp, the nerve supply to the tooth. Mm-hmm. That is where the pain will arise from. So in most cases, most patients, or us human beings, we sit until we reach that process, of which it's a long-term process. For you to reach pain, it should be something, sometimes it takes years, because we have the enamel, the hardest part of the tooth. For the enamel, the process will be slowly going in, and it will reach the dentine, the sensitive part, then will reach the cementum, which will involve the pulp. So for the pulp, we are talking about the nerve supply to the tooth. Mm-hmm. That is where, when it touches that part, then you are going to start having pain. And that's when people will come to the hospital.
Okay, now talk to us about cavities. When I was young, it used to sound like, what would I say? Like it's a word that is so heavy. So talk to us about the causes of cavities.
Okay. So like I was explaining about the tooth structure. Cavities, you find that we have cavities as a result of the way we are taking care of our mouth. Poor oral hygiene, which is always mostly related to the type of foods that we eat. You find usually we like sweet things, we like chocolate, we like cakes, and the time we take our cakes also matters. We are not saying don't take cake, but you try to take cake at night when your saliva level is low, it's reduced, so the bacterial activities is high. Hence, you find that you develop a cavity. Sometimes the cavity can come in as a result of gastric from the stomach. It goes and affects the dentine tubules. Okay. Then now it will cause erosion of the tooth, and it will, like, what can I say? the simplest term would be ukusungulula ichakosa.
Oh.
Iname ukuyisungulula bayisungulula because it's the hardest part. So ngaya sungulika like that, then the dentine, the sensitive one, will be exposed. Of which epada mumfat no nganariefia kaba ngananwefia talala, I have that pain. It's coming from there. Because the hard part has been neutralized. So after that, then you find that it goes down deep, now goes to reach the pulp. It's an infection spreading. Actually, dental infections are very, very, very bad. Sometimes they even involve the systemic system. We've got cases where someone ignored a simple cavity which started now 5 years ago. Yes. And then they come to present to the clinic when it's too late. Yes.
So, nalimona po abantu akwati balafunya blood in my gums. Talk to us about that. Gum disease, maybe. Is it separate from what you've just told us?
Not really. There's a very strong interaction because when we are eating, like I said, we eat and then initially we're supposed to brush our teeth twice, morning and evening. So you find that at night we don't do that. Then when we go and sleep, saliva reduces. Bacterial activities is there. To just put this across, the mouth has got over 1 million bacteria. There are a lot of bacteria in the mouth. Oh, yes, okay. It's the most, the best way to say that, it's the most infected area. Yes, that's got billions of the human body. Okay. Yes. So you find that in that case, when your saliva level drops, your bacterial activities go up. So if the bacteria release acid, which hardens to your teeth. So your teeth, like I've said, the structure of the tooth, it has got gum, like the gums, the way we have got the gingiva, we call it gingiva, but it's called a gum, and the periodontal ligaments. So this gum will get irritated. This is the human body. It's trying to respond to the irritation because the acids have been released, they have been neutralized there. So at that point, then it will cause irritation, which will cause what? Swelling. When it swells, as you are trying to brush, you find that you are bleeding. You're bleeding. When you come to the hospital, we'll tell you to say, okay, this is what we are doing. We're going to do scaling and polishing. We will remove that hard stuff that is holding on to your tooth. Yes.
Okay. I'm sure you come and remove them. Okay, now, how do I manage dental pain, either at home or clinically? Do I have any traditional remedies?
Okay, for the traditional parts, we usually, we've had patients who have come in to tell us to say, no, tuari wonfiako acid, dear battery, tuari bambibali watemesha kwenembo, something like that. But that's not allowed. When you have dental pain, if the best you can do, if you can't get to your nearest hospital, please, you can take off-the-counter painkillers. You can take your paracetamol, you can take your Brufen and come to the dentist. Because sometimes you find that the more you keep on self-prescribing the medication, the more the problem goes, increases. It goes expanding and it will result in very, very life-threatening conditions. Yeah.
Okay, now give us some relief options.
You can take Panadol. Everyone has Panadol, and almost every pharmacy would give you Panadol. So you can take some Panadol. Others will talk of, if you look at Google, you hear them saying you've got clove oil, which will have both antiseptic and analgesic properties. So maybe it will just hold on to the pain. This is what I'm trying to say. It will just hold on to the pain. Maybe you get a relief for 2 to 3 days. But the infection process will continue going on and on and on. And in the end, you find that chafimba.
No, but I think we live in communities where there are a lot of what I would call self-proclaimed doctors. Na mnapovada pita community, natukwato mti wa meno ngamwavika kofie nishchapwa. Those traditional medicine, are they proven scientifically to say they can heal toothache? I'm sure mwali umfuapo na imi. As you iringivenda naka megaphone. So natukwato mti wa meno ngamwavika kofio mkumo, mwatonesha kofio mkumo. So how do you advise such patients?
Okay, we've heard of such And to be honest with you, those things just delay the process. Like I've said, it will be a small relief. 1 week, month for 2 weeks. Then now you come to the dental department, you are swollen. Now Mufimba, we even reach, even your airway is blocked. We've had conditions like that. So it will just be a temporary relief. But anyway, others would say it worked on me, it worked with me, such things. But it is not advisable. Come to the hospital. The dental hospital is open 24 hours. If there is no one there, there's someone on call to attend to you. So if you feel like you've got a toothache and just started there and then, you would want to save your tooth, come to the dental clinic.
Okay, before we get to talk about pregnant women, there's this notion that the cavity moves to the next tooth. Is that true?
No, it's just a myth. It's common. You find someone telling you, when enough so it's just a myth. It's just people's I don't know how
perception.
To say it. Yes, people's perception.
Okay, so talk to us about our pregnant women. I mean, is there any special treatment for them? Is there any infection that relates to dental and pregnancy?
Okay, we've had, even right now as we are talking, even our association is trying to see if we can engage our colleagues in the gynecology department so we can see how we can work around the issue of dental pain in pregnancy and its relation. In most cases, you find that when a person is pregnant, the hormones are there. You know how pregnancy comes in. Every woman will say, and there are those that keep on spitting. Of course, we know that when someone is pregnant, the estrogen and progesterone hormones are high at their peak. So in such a situation, the warmth is there. So it harbors bacteria, of course. It harbors, and as we have said, there's less saliva in your mouth, then there's that warmth that is harboring bacteria. You tend to be prone to these dental conditions. We've found, even if it's, sorry to take you back, even if it's just not pregnancy, when you are almost having your menses as women, you find that your gums are swollen. So now you're wondering, what's happening to me? Why do I have my gums swollen? So this is the hormonal changes that are happening at that particular point. The gyne people usually understand this part. So for me, I'll stick to my dental part. So in that particular time, you find that pregnant women are very prone to that because of the bacterial activities, which is high. As a pregnant woman, you realize you have a toothache and you are at home. What I can advise is, if possible, try to rinse with warm, salty water. Warm, salty water will not be harmful to you. Okay. Please don't take drugs that will harm you and your baby because you are focusing at two people and that at that particular point. Okay. So you can use warm, salty water. You can use a bit of clove oil as well. It's allowed for rinsing. We are not saying you swallow. If you want any painkiller to let me say you want to ease the pain. If the pain is too much, before you reach to at a dental clinic, you can use Panadol. Don't use drugs that you are not prescribed for. Okay. Do not use drugs that you are not prescribed for. And there's that myth which says, it's a lie. We remove. We remove. I mean, our lignocaine has no interaction, like it doesn't harm the baby. And sometimes you find that the benefits are more than the risk that you have. If we remove your tooth, maybe because it's first trimester, we'll be a bit relaxed in doing the thing. Or maybe
when you say that, what do you mean?
What I mean is that in first trimester, we know what's happening. There's development. The baby is also developing. So maybe there might be a bit of, we'll weigh the risks and the benefits. If we find that a pregnant woman comes in with a toothache and it's very bad, the risk will be more because we've got bad complications of toothache, which it's just that we could have come with pictures so that you see how bad it gets. So if that's the case, we will weigh the risks and the benefits involved. If the benefit is that we remove the tooth, we'll remove the tooth, because dignocaine or epinephrine in that tube we use will not cause you any harm as such. Yes. So we factor in those things. That's why it's important to always come to the hospital. Other pregnant women will tell you, until na papa, and then they come in.
When it's too late.
When it's too late. When we are admitting now, when we are doing, there is pus that has formed. There's now necrotizing fasciitis. The entire body is rotten. You are even wondering to say, where was this person all along? So there, even maybe sometimes others will be told at the clinic, no, please come. Let us be the one to advise. And when you come to the hospital, we'll work with our gynecologists and we'll achieve the benefits for you and the baby.
Okay. Now, apart from rinsing with salt water, what other safe practices would you advise for home use?
For home use, usually we advise brushing. You have to brush your teeth. Unless otherwise the doctor will tell you to say use when we look at your teeth, of course, and we see to say, okay, this is this is a sensitive one, maybe there's a bit of erosion, then we'll prescribe Sensodyne for you, we'll give you Dentin for you, but usually that same Colgate, the normal Colgate that is always there, it's usually recommended.
Okay, you've been talking for some time, so let's talk to Miss Kapena now. Talk to us about dental care.
Dentures?
Yeah.
Dentures, the dentures.
Yes.
Yes, so dentures are basically artificial dental prosthesis that is used to replace teeth, the missing teeth, the ones that have been extracted or lost through trauma, say be it an accident. Yes, so we usually fabricate those. They also...
So initially, artificial.
So yes, dentures basically replace teeth that has been lost. Yes, they are artificially made, of course custom made to each patient. Yes.
So you look at my teeth, then you factor in the size,
yes,
the color,
everything. We are all different. The shades of our teeth, the shape, even just our facial structures are different. So when we're replacing the teeth or other oral soft tissue or any area in the mouth, we have to measure. Everyone's different. I like individual measurements so that we get the right fit. So just because you and me have lost our front teeth doesn't mean that when I fabricate a denture it will fit you. No, it won't. Yes.
So how do I maintain this?
So dentures, I think the most important thing that you need to remember is they are not part of your mouth. They are plastic. So you don't need to keep them in your mouth for a very long time. And when they're not in your mouth, they should be stored in a container of water, which should be changed at least every 2 days. Just normal tap water. Every time they're not in your mouth, you take them out, you rinse them with water. If you want, you can buy a toothbrush for them so that you can clean them. Make sure you clean all the artificial teeth, the surface. If you've seen dentures before, have you ever seen dentures?
Not yet.
Okay.
But they're plastic, so I can't tell the difference.
Okay, yes. So the dentures usually have a base, and then they also have the part with the teeth. So we advise that you clean the teeth and you also clean the base, and you will store it in water whenever it's not in your mouth. And in case you experience any difficulties with them, or you feel they are loose, because that happens over time, if you use them for a very long time, your mouth tends to, if you've extracted some teeth, sometimes the soft tissue tends to, I think, shrink. I can use that word. So that happens with, like, if you use the dentures for a very long time. So if you experience all those, you come back to the hospital so that we can make some adjustments and, if possible, maybe make new ones.
Okay. So how long should I keep them in my mouth in 24 hours, for example?
So we advise that you use them very often because they are foreign. So first-time users of dentures usually have a very hard time because there's this foreign thing in the mouth. so it's difficult. So we
it
advise.
feels heavy.
Yes, some say no. Usually, some, the tongue. If you notice, your tongue moves a lot around in the mouth. So the tongue is the first thing that will notice the foreign object in your mouth. So some will fail to pronounce certain words. The speech will definitely be distorted. So we advise that you still use it in spite or despite of that. Like, you use the dentures, you eat with them, because one of the main purposes of the dentures is to help or aid in chewing of teeth, especially chewing and biting and just returning the aesthetics back to your face.
Okay.
So
what type of foods are we talking about? Can I still eat that type of meat if I have dentures?
Okay, so you can have your food, you can have your meat, but not to kokota mafupa.
No, okay.
So you can have food, normal food, well cooked food, but of course there are certain kinds of foods that you need to be wary with. Say, for example, apples. I always advise my patients to maybe slice them up, because with my natural teeth I can just bite into an apple. But if you have, say for example, a food denture, which is the type of denture, in this case, all the teeth in the patient's mouth have been replaced. So we advise that if you're eating foods like apples, you slice and then you eat a piece at a time. So you have the dentures on throughout the day. Maybe if you visited, because sometimes when you visit, maybe you don't want to take them off, you can sleep with them. But we advise that if you've had them the whole day, ichungulo, you take them off, you clean them with just normal running water, not warm water, not salty water, just normal running water, with a toothbrush. If mamonati, like our natural teeth, of course, nakwikatako, if yakudia, or some debris from whatever you were eating during the day, you can use some soap. We advise to use some liquid soap. Do not use toothpaste, because it interacts with the chemicals that are used to make the dentures.
Oh, okay.
So and that might change the color and just the overall integrity of the denture. So we advise that you use some liquid soap just to clean off the dirt, and then you proceed to putting it in a bowl, like a cup. Some use a cup. Those spice containers that have lids?
Yes.
Some use those. And if you are fortunate enough, there are some denture containers that you can use. Yeah, and then if also, again, you're able to afford, there are what we call denture cleansers that are sold in pharmacies and chemists.
I should presume they are expensive. Okay, now in case they are damaged, what do I do? I just come back to the hospital, or is there some home remedy before I come into contact with the dentist?
So yes, when the dentures are damaged, broken, you notice there's a fracture, you notice anything wrong with your dentures, you're supposed to come back to the hospital. Usually we have patients that maybe they were at work and then maybe the denture falls, or if you leave it carelessly, maybe the children come across it and play with it and break it. No, I put some glue. Please don't do that, because what glue does is it disturbs or it distorts the fitting surface of the denture, basically. So when your denture is damaged, it's broken, you notice there's a fracture or anything wrong with it, we advise that you come back to the hospital. We know how we fix them, and we can make it better.
Okay, nice. Now, Dr. Mijelo, I get back to you. So, in routine, how often should one visit the dentist?
Okay. So, if your teeth are okay, after probably just look and say, okay, they are okay, everything is okay, please see us twice in a year. And
I don't remember visiting a dentist anyway.
You should come. Yes, so you can see us twice in a year, and then on the second appointment, I'm sure your dentist will advise you to say, okay, want to monitor something, or you should come after 3 months, you should come after 2 months, or want to see something. They will advise you as you are coming. Because anyway, like you have said, others you find that from birth they have never been to a dental clinic. Yes, so you should visit us.
And then maybe it's a question of a charge. Do you charge just for regular checkups?
Okay, Ndora Teaching Hospital is a referral hospital, so we get referrals from other clinics. So when you come in as a referral, we do not charge for checkups. But if you come in for another procedure, there's a little charge, just a little one. And there's even NEMA. We are NEMA accredited, so you can even use the NEMA scheme. I'm sure now almost everyone is using NEMA. So there's even the NEMA scheme. But we are a referral center, so we are not charging consultation.
Oh, okay, nice. Now there are people that obviously we ignore a toothache. Ndio mfakale kadba adimbia ngana no mfeka spirit ka whiskey or it goes away. So what are the dangers of me ignoring my toothache?
There are many. There are so many. You ignoring your toothache will make the bacterial process continue, which will result in what we call one of the life-threatening conditions we have in the Ludwig's angina. It will even block the airway. So when you are coming to the hospital, you would hear that it is not fair but theater. That's what happens. We even would go and access the airway. Sometimes you even find the pus has gone all the way to the chest. Yes. So it's very dangerous to ignore even just a simple toothache, a simple uncomfortable part in your teeth. It's something that at least you shouldn't just say,
Okay. Now, I know we have 15 minutes left before we come to the end of the show. It's that time that we can encourage phone calls. You can come through in case namkwateri pusho mlefo kuipisha wa Dr. Padi issue ya meno +26021261740. That's the number that you can use, +26021261740. Alternatively, you can send me a WhatsApp message on 0769122851. That one also covers your conventional messages. They can also come through. Now, Ms. Kapena, there's a message via WhatsApp here. God. There are those, I mean, you were talking to us about dentures.
Yes.
Are those also coming in from the expert like you?
Yes, actually, those are what we call, they are another type of dental prosthesis. This, ideally, it's purely for cosmetic reasons, like okumoneka fewino. Yes, but those, say for example, you lose a tooth today, and you feel like you will not manage, because with dentures they are removable, and then you feel like you won't manage to always put them on, take them off. We do have an option of fixed prosthesis. So there are two types. The first type is an implant, and then this specific one that our textile or caller is talking about is called a crown or a bridge. Okay. So basically what happens in that scenario is, we say for example you're missing one tooth, we will use two other teeth, your adjacent teeth, both on the left or on the right side, to create a bridge to replace the tooth that's missing. And then we can use material like gold plated, yes, just to give that aesthetic. People like that, it looks good, you want to look like the rappers. But yes, we do make, I'm able in my profession to make those, and even I think I've seen people around in Ndola who have those. Right. Yes, so yeah, there's that option.
Okay.
Yes.
And then just I think this particular person was not here from the time that we started. Obviously the question for them is, what are the changes? I think you did touch on the changes of how one will talk, how one will eat, and maybe run us through. Maybe they were missing the time that you were discussing this.
Okay, so when you are a new denture wearer, like if you get your denture for the first time, of course it's not part of your oral cavity, it's new, it's a foreign thing in your mouth, and it will take some time for you to regain or to resume normal functionality like speaking. Chewing, ideally you should be able to chew very well without any discomfort. That's the whole, yes. But speaking, say for example speaking, you might have some difficulties pronouncing certain words. Even as you speak, people will think there's something in your mouth, And also just your tongue is the first culprit also, because it's there trying to, it's used to resting on the palate, the top of your mouth. But then there's something, so for example, if you have a denture replacing teeth on your upper jaw, the tongue usually rests on the palate. So when you're speaking, it has that, it's meeting something else that shouldn't be there. So, but that takes time. We advise the patients to not lose hope, because usually I get calls, no, I'm failing to speak, I'm a public speaker, but then every time my students are laughing at me. But we advise that you keep wearing. I'm
imagining myself on radio.
Yes, we advise that you keep wearing, unless you are feeling any discomfort and you cannot chew your food properly, you are feeling pain on your gums, on your sulcus, we advise you come back. But in terms of speech, that's something that should go away in a week if you continue to wear it properly. And yes.
Okay. And I mean, it has been a roller coaster. But before we go, Dr. Mijelo, do we have any dentist day during the year when you people come together, commemorate this day, exchange notes?
Yes, we have
share experiences.
Yes, we have. It's 4th March.
Yes.
Somewhere 20th March.
Yes.
Then we've got oral health awareness. The whole month. I think that is October, November. It's usually done every year, and most dentists will come together and would have the.
That's the time you offer free services.
Yes, you would even see posters. You say, "Come for free consultation, come for free work." Everything that is, it's aligned like that.
Okay, as we come to the close, seeing that people are shy of calling us, as we come to the close, maybe what's the message that I should take home from you, Dr. Mijelo? Then I'll get to Ms. Kapen.
Okay, the take-home message is that please see a dentist.
Every often.
Come and see us first, and then we'll give you an appointment for another time that you can come. This is open for everyone, even those people with special need. Please bring your children for dental checkups. Yes.
Okay.
And stop self-prescribing drugs.
Okay. Now we want to go, and my phone is flashing. Okay, let's pick this one, Oliver. +26021261740. Good morning. Hello, good morning.
Hello. Yes, good morning, Mr. Foley.
Let me have volume on the speakers. Good morning.
Yes, good morning.
Yes, Oliver, can I have volume on the speakers? Hello, you can go ahead.
Yes, good. Yes, my question is, kwali babali abantu abakwasa ati bali kwataka chena whether nas some can one so good twaba question bali abantu abakwebata so lataka chena kala kabweshe ba kale ko kumfika am principle tinga bofo benga bompya ko za kubafuirisha
to atotela sana nangu tamwachi twebeshi na nimwe bani
nego tule
mule tumina kwisi
tunamna mwine mundora bizaka randa vile.
Okay, thank you very much. I'm sure Dr. Mijelo, this one is directed to you. So, bali kwa tafyaka chena, kakufyarwa nako. How do we help them?
Okay, so I'm sure she's talking about bad breath.
Yes.
Yes. So, akachena, like she has said it comes from. Let me say. Sometimes it will be coming from your mouth. To start with. Why? Due to poor oral hygiene. Others don't even brush their tongue and their palate. So you find.
So which one is the palate? Maybe which in Bemba, which one is the palate?
Achana, how do I say it? Yeah, pamulo.
Oh, okay, the surface, pamulia, mouth.
Yes, pamulia mouth. That's how I can say it. So you find that other people do not brush their palate. They not clean their palate. They don't even clean their tongue. Usually, even brushing, they don't take more. Like it's just seconds. Brushing time is 2 to 3 minutes.
So the one recommended is 2 to 3 minutes.
Yes, 2 to 3 minutes of brushing your teeth. Then you clean your tongue. Then you clean your palate as well, and you rinse. If you realize that there is some, like the one we were talking about, bleeding gums, the tartar that accumulates around your teeth, that is where now the dental people now come in. We do cleaning. That cleaning, your toothbrush will never remove it. Yes, it's a procedure called scaling and polishing. So we scale off twafifunya. It's also a lead of bad breath. But the other cause could be coming from your stomach.
Oh, okay.
So once we do our investigation, we realize that it's not coming from us. We will refer you to a general doctor.
So if it's coming from the stomach, it means the general doctor is the one to deal with it.
Yes, the general doctor now will let us know. Maybe we are dealing with usually the conditions that lead to bad breath is which one? Gastritis? Yeah, sometimes. But you find, because there is acidic release of the acidic secretion that is released, and it comes through. People got to the fibiola.
Oh, yeah.
Yeah. So once we treat the medical condition, problem so they need to be seen. Yes.
Okay, nice. Okay, Ms. Kapena, before we go, your message, that what you want people to take home from this discussion.
Okay, so I will speak to both the denture wearers and for our patients or clients that don't wear dentures yet but they've lost teeth. It's very important to replace teeth that have been lost because it will return cosmetically. You know, most people are very self-conscious about their appearance, so that helps the patient, and also it helps with chewing. Chewing is a very important function of the teeth. If you take away that, food will not be masticated, like we say, properly for the stomach to digest. So we advise that if you've lost teeth, whether the front teeth or the back teeth, please come and have your teeth replaced, just to aid in that functionality. And for our denture wearers, remember to clean your dentures to maintain oral health. Do not clean the dentures or together with whilst they're in your mouth. Take them out, clean them separately, brush your teeth separately, and maintain good oral health, because there are some patients who've had dentures for 2 years, 3 years, and then maybe they have an issue, they develop an infection, they come to the hospital and they say, I've never removed it. No. If you have a denture, unless you have another type of dental prosthetic like the fixed ones I mentioned earlier, but if you have a denture and you remove it and put it back into your mouth, please clean it separately. Make sure it's always stored in normal tap water, and also maintain your own oral hygiene very well.
Okay, maybe before we go, do you also have a day when these people that use dentures come together, share their experiences, talk to each other?
Well, we do share the same oral health day.
Okay.
Yes, but you can come to the hospital and you will find us and we'll help you.
Okay. Okay, thank you very much. I'm glad that you took time just to explain us the importance of dental health and awareness. And obviously, it is my hope and prayer that our listeners have actually benefited from this discussion. So this is where we come to the close of today's edition of Health Talk. We're discussing dental health awareness, and obviously my two guests were Dr. Mijelo Sayela, who is a dental surgeon, a dental and maxillofacial department from Ndora Teaching Hospital. She was accompanied by Ms. Chitalu Kapena, who is a dental technologist from the same department, and I think they've done a great job with regards to explaining to us. We now know what to do, and please don't forget to visit your dentist. I think what I've taken home from this discussion is that we should visit the dentist as often as possible, so that they can give us another appointment in case we have any other issues that need to be attended to. We can be advised professionally and accordingly. So on behalf of my two guests, my name is Lamek Zulu, professionally known as Four Legs, saying God bless you. Continue enjoying our programming, and please join us next week, Saturday, for another informative and exciting edition of Health Talk. For now, we are out. Bye-bye.
Bongo Bongo, Zambia's #1 casino. Join now at